We know that there have been a lot of lessons learned from the pandemic, both as individuals, but also as a legislative body and as government. One of those things I think for government is about how we can be better prepared for these sort of health emergencies and crises. And so when we look at this budget that's being proposed, what is the department's plans on preparedness, knowing that we can't necessarily prognosticate the future or when something like this is going to happen, but we want to ensure that both the legislature, but also our constituents across Commonwealth feel confident in the preparedness of the Department of Health. So what is the department doing in terms of preparing us for another crisis like this?
Well, thank you. It's lovely to see you. Preparedness, certainly the pandemic made it very clear that we need to be better prepared. There are areas where we did well and areas for improvement. So a couple things is we are, of course, looking back using the retrospectoscope and seeing where we need to improve. Our emergency preparedness team is strong and working on sort of reviewing what we call sort of after action and looking to where we have holes. Some of that is we still have some funding left over from COVID that we're using to make sure that is happening. It funds some of our laboratory. That's a really important part of our preparedness program, our public health laboratory. And we have other areas that we continue to work on. Again, we've had our preparedness tested already in this new administration with the train derailment. And so really making sure that all of our teams are working together, communicating effectively, not just with ourselves, but across all of the other agencies that work on emergency preparedness. So with PEMA, AG, Environmental Protection, et cetera, Department of Human Services. So as I'm learning the department, I'm fairly new here. I'm trying to learn the intricacies of all of the programming here, really trying to break down silos and making sure all of our all of our programs work together because, I'll give you every emergency is different, right? So that, I can talk to the WIC formula when there was the formula shortage, right? You might use different parts of the department than you used for a train derailment. And so what we have to do across the entire department is to make sure we know what all those resources are, who's available, who's got expertise, and making sure we're collaborating. So that, for me, is part of preparedness, and a component that I'm very focused on is to really work across and make sure everybody's ready for preparedness, not just our one group for emergency preparedness.
Awesome, thank you. And then my second question is, I see in the proposal there's a focus on providing additional funding for local, county, and municipal health departments, which I think is fantastic. Could you help us better understand the relationship between the Department of Health and those sort of local, hyper-local departments in terms of, does the Department of Health provide directives on how service should be provided in those local municipalities so that we can ensure that there's parity in the type of service that's being provided from one county to another? Can you help us understand that relationship between you all and those local counties and municipalities?
Yes, that is something I know quite a bit about. So there are 11 county or municipal health departments across 67 counties in Pennsylvania. And that ability to have a local health department comes from Act 315 that was passed, 70 some odd years ago. And the local health departments, when you have a local health department, they have jurisdiction over whatever whether it's a county or a city. The support, and then for all those places that don't, the state provides that through our state health centers and through our programming across the entire Commonwealth. We have the legislature provides funding through the local health departments, both through Act 315 and Act 12. And we're asking this year, I'm very excited that the governor has put in his budget to fund those local health departments as fully as the law allows. So I encourage you all to look at that and to support that. We also get pass-through dollars. So the federal government provides some funding through the CDC and other places to the state. and if the state, and also to large cities. So Philadelphia often gets their own federal funding, but we get it for the entire rest of the Commonwealth, and we are a pass-through and share those federal funds with local health departments using various formulas that are often dictated by the federal government. So the local health departments get both money from the state as well as federal pass-through through us. We don't oversee them, but we do support them. So for instance, if they're lacking staff, if they need help, we have a lot of shared discussions on many topics. So for instance, we have meetings on specific programming that we have both at the state and the local area.